Go ahead.
Okay, today we're going to review how to order a referral for the internal CHCY blood pressure monitoring program from a provider standpoint and also from the MA standpoint on how they will process that request. So from a provider standpoint, the provider is going to be following their normal workflow in ordering a referral. They're going to be in the referral template. And this will be the same process that they currently follow. We have added a CHCY blood pressure program category for them to use as a specialty. And then they're going to go ahead and put in the diagnosis for the patient. At this point, the provider has determined that this patient would be a good candidate for the program. So once they have the referral placed, they're going to go ahead and hit add. And instead of tasking this to the referral department, they're going to task it to the blood pressure monitoring program. So they move that over and hit OK, and now the order has been placed. Now,
What if the provider, sorry.
Go ahead.
What if the provider ordered multiple referrals?
Perfect question. So the provider had multiple referrals, for example, cardiology, gastroenterology, and they had already hit add and tasked those to medical records. They can still go back in here and place the referral for the blood pressure program. And then they're going to hit add. Nothing will happen, but it's going to place it at the bottom here. So for them to send this by itself to the blood pressure program, they have to highlight that referral. And then they're going to hit send task. And then at this point, they can go ahead and task it to the blood pressure program. So once again, if referrals were already ordered in this section for different specialties and they had been tasked to the referral department, the provider can then go and add the blood pressure program referral. And then they hit add to place the order in this section, but then it's not going to prompt them to task it because they have already sent a task. So they just have to go and highlight it, make sure it's highlighted in blue, and then they hit send task. And then at that point, they can send this one to the different group. In this case, the blood pressure monitoring group.
Okay,
so
thank
this
you.
this is the process for the provider. So now from the MA on the checkout level, when the MA goes to check out the patient, she's going to notice that this patient has probably multiple referrals, maybe the cardiology and gastroenterology one. But when she sees that the patient's been referred to the blood pressure program, she's going to go into the documents. And in the MA document folder, we have added these 3 documents. So the first one is the BP monitoring info letter. This one's already in Spanish and English. So if this one gets generated, it's in both languages. And this is how it looks. And the MA just has to print this, which will prompt them to save it. And then the other document is also in the MA folder. It's the BP welcome letter. We have that in English and Spanish. So I'm going to go ahead and generate the English one. And then again, the MA will go ahead and print it. This is what it looks like. And then it's going to save in the documents for the patient. So these 2 documents will go to the patient. I'm going to go back to the checkout tab. So then the MA is going to do their normal workflow in this section and then generate a patient plan for the patient, give the patient plan to the patient along with the 2 documents that go to the patient. Now, from a blood pressure monitoring program, they're going to use the OSAS utility to go ahead and then filter out any referrals that were made to this program. And that way they can see all the patients that have been enrolled. Along with that, they're also going to have the task that's been sent to that group from the provider. So do you have any questions from the MA standpoint?
Just to confirm, it's just 2 documents that the MA has to generate, correct?
Correct. So the MA is going to generate in the MA document folder, she's going to generate the BP monitoring info letter, which is in Spanish and English. And then the other one will be the welcome letter, which is going to be either in Spanish or English. So the MA prints these two documents, hands those to the patient, of course, along with the actual device for the blood pressure cuff. But this is the only two documents that they will be generating and handing over to the patient. And then everything else will be their normal workflow on the checkout tab.
Okay, thank you.
Okay, if you don't have any questions, this concludes our meeting. Thank you.